Why is stretching of the hamstrings, the inner thighs, the bottom, and the muscles that lift the feet important? During riding, we build up a great deal of tension in all these muscles, and the same applies to them as to the abdominal muscles and the other muscles that I've mentioned before. Any long-term tightness can lead to shortening and movement impairment, and the inner thighs, the adductors, are the ones that clamp your legs together and are particularly important in achieving a firm seat, so the rider can't be pulled out of the driver's seat by the horse. So they get a lot of stress and strain during riding. I've noticed for myself that since I'm riding again, my inner thighs and my hamstrings have become very shortened, and also the muscles that lift my feet, because obviously we're always asked to sit at least with the feet level, or maybe with the heels down. So our feet have to be lifted up by those muscles. And all those, I've noticed on myself, have become very tight. I used to be able to do the splits before I started to ride again. Can't do that anymore. And bending forward is just getting that a little bit harder. And I do think that it is very important that we maintain that movement for riding as much as for our everyday life things that we do. Maybe some of you do exercises. So I think we need to work on that quite regularly to keep the range of motion going with those. Why is stretching of the hips important? During riding, the hip flexor muscles and the front of the hip play a very important part in maintaining the rider's position in the saddle, because they link the pelvis and the spine to the thigh. And the thighs are what keep us connected with the horse during its forward motion. Especially in riders who ride with short stirrups, the demand on these muscles is quite great, because they work from a shortened position, and muscles can generate a lot of power in the mid-range. If regular prolonged contraction of these muscles is not counteracted by stretching, they will become shortened, which leads to hip flexion contractures that cause the pelvis to rotate forward and the lumbar spine to be hollowed, which can hinder the seat in a neutral spinal position. Also, hip flexor tightness can be quite uncomfortable. Why is stretching of the abdominal muscles important? Mary Wanless of Ride With Your Mind proposes that the rider needs to be stacked up on him or herself in order to optimize his or her own center of gravity, as well as the abdominal strength. This involves being quite short at the front, but not hunched, as opposed to the frequent teaching that the rider must be long in the front and even lean back a little. Being too open at the front makes the rider weak, and leaning back too far forces the rider to be behind the horse's movement almost permanently, in the worst case scenario using the reins to stay in balance and being unable to control the rise and the fall during rising trot independently from the horse's movement, and thereby the rider then relinquishes control over the speed. As the abdominals should be engaged for prolonged periods of time, ideally the whole time while we're on the horse, it is quite important for a regular rider to stretch those muscles to prevent shortening. It's also quite a nice thing to do because it is quite a release, really. foot, it is actually quite important. I will turn Lisa around in a moment and show about the foot. If you just give me this hand here, and that hand wants to go there. And you should feel it in this leg and obviously also in this leg. Alright, okay. What I want you to do now is just change this leg to here. So you sit like this. Okay, and now this arm goes here. This one obviously now is again a hamstring stretch for here, but it also stretches your back on the side where the leg is bent. Can you feel that, Lisa? Mm-hmm. So that's quite a nice stretch for your back here, and it's quite nice to do after you've ridden. Some people get quite tight in the quadratus lumborum and in the... Oh, get off! Erector spinae. And your shoes back. Stop. So I want Lisa to sit as straight as possible there. If you can get your legs out a bit more, that would be great. Put your hands behind your head, nice and tall and straight. And now I want you to go elbow to floor, and then down there. Again, Lisa is downhill at the moment, so it's not that easy. And I'm supporting her back at the moment because I want that to stay quite straight. Keep going. Okay. Thank you. Here now. And down here. And what I want Lisa to do now is see how far she can reach forward. And again, the idea is that the stretch should come from the hips rather than from the back. So the ideal position will be straight, there, and then you just bend from the hip. Okay? And once we've got the hip flexion there, then Lisa can actually bend the back a little bit to see how far she can go. Go to the edge of the top. Yes, good. Knees should be straight, and the feet should be up rather than turned in. this one over. There. And now push this one away with your hand here. Okay. Push it away, and just keep the pressure. You should feel the stretch in here. People that are fairly flexible and not very tight will probably not feel very much. Then you can increase, and you can use a wall. If you imagine on the wall, you can put your own foot against the wall. And just put this one down. And the other version that you can do is grab this foot with this hand and just pull your leg over now. Now play, see where you can feel the tension the most, whether your knee is down there or up there, and just hold that one. Then you can even, if you want, you can just hold it there. And you should feel it around here. Okay, thank you. Of course you want to do both sides, but we'll just do one side for now. Done. We're going to do the pigeon now, and that's the yoga name again, and there's a yoga way of getting into it through the down dog, but different instructors do it differently. So Lisa, if you just get into the pigeon however you want to do this. Lisa has never done the pigeon before until today, so this is a new exercise for her. Okay, so what we're trying to stretch here is if you can bring that foot up a little bit more. See, I don't want you to sit on this leg like so. Bring this up a bit more if you can. And the hip here is down. So you should feel a hip stretch here. And ideally, if you're in the correct position, you should also feel a stretch in here on your adductors and hamstrings a little bit, on the inside of your thigh. Okay. Change legs, Lisa, to see if you can do the other one better, if you find that easier or more difficult. Again, ideally, we want the leg a bit more over like this. Yeah. Okay. And then we stretch here again. Thank you. Alright, and flat. Okay, so this is very easy for Lisa. This again opens up the hip a little bit, which exercise, and what I would like you to do now is keep your legs like this and come up on your elbows. Just bring your elbows in. Okay, so now we're actually increasing the stretch on the hip, and we're also stretching the back. Flexing the back backwards, stretching the abdominals a little bit. The next exercise now is a quad stretch, and you can either do it like so. Lisa, if you grab your foot, and it's important that you have your knees together, and because your quadriceps, your rectus femoris goes over your knee and your hip, you can only get a proper stretch if you have your hips straight and your knee bent. A lot of people want to lift their bottoms up when they do this exercise. So what I'm going to ask Lisa to do is to imagine that you've got a 50-pound note in here and hold on to it really tight. Can you feel how that increases the tightness on the front of your leg?
Yeah.
Okay, this is because we're actually stretching the hip back by tightening up here. Okay, change legs. Doing the same thing there. Hold on to your 50 pounds, really tight. Okay, and now just grab the other leg at the same time. And what I would like you to do now is, if you can, lift your legs up and lift your front up as well, lift your head up. So you're in this position. Okay. Now comes in the breathing. Don't make your eyes pop. Okay? Keep breathing. A lot of the time I tell my patients to count to 10 loudly, because that way they can't hold their breath. And this is really important.